to the podcast of Wednesday's Child. Today we're going to touch on a really interesting topic that always gets people having an opinion. So whichever side you sit in the arena of the world, we're talking about neurodiversity. I hope you're going to find this a very, very interesting conversation. Joining me is our wonderful eating disorder therapy specialist. That's Sarah Parker. Hi, Sarah.
Hello, Debbie. It's good to be here.
Well, it's really good to see you, and I'm so glad we're doing this topic because off mic, you and I have often talked about neurodiversity, where it sits with eating disorders. Is it a separate thing? Is it the same thing? Do the two blend? Is it always the case that somebody with an eating disorder has neurodiversity and or the other way around? So let's start with this. So when we talk, let's go right back to basics for someone who says, I hear this word talked about a lot. And, you know, if you're someone that's very well versed in the world of neurodiversity and you're listening to this going, oh my God, who doesn't know what neurodiversity is? I just think we need to go right back to basics and talk about neurodiversity. What do we mean when we say neurodiversity?
So when we're talking about neurodiversity, we're talking about all of us, the diversity of all of us, all of our brains, all of our ways of thinking. So we're all within that neurodiverse kind of bubble that says, you know, we're all unique and we're all diverse, and we're looking at all of us. When we're looking at neurodivergence, we're looking at somebody who diverges from what we call neurotypical. So that might be, it might be what we typically think of as things like autism, ADHD, it might be dyslexia, dyspraxia, it might be head injury, anything, any kind of nervous system thinking style that is different from what we would class as neurotypical.
A subtle default to what once upon a time we would have referred to as, you and I know in the world of eating disorders there is no norm, but we would have said the norm, the person who is the norm. And frankly, who in the world has ever been a normal? And if they think they're a normal, they're wrong. And they probably have many more problems than they think they do. Okay, so we're talking about people with neurodivergence. Now let's bring this back into the room of our wonderful world of eating disorders. What, in your experience, is the likelihood that somebody that comes in to see you for therapy with an eating disorder has also a neurodivergence issue, whether diagnosed or not?
Yeah, I think that the figures vary from kind of 30% up to 60% or even more. And so, you know, depending on where you look, the figures will vary. But we know that people, particularly with autism, ADHD, will be massively overrepresented in the eating disorder world. So, you know, whatever we talk about, we know that there's an overrepresentation of neurodivergence.
Yeah.
But certainly in my work now outside of the NHS, I would say a really high percentage of the people that I work with eating disorders are also neurodivergent. And often that's because, sadly, they've worked with NHS services and they haven't taken into account their individuality and the needs. And so they tend to come to me after they've tried other things that have not been so helpful. Now, that's a blanket statement, Debbie, and please don't hear me saying that NHS care is bad per se and not helpful for neurodivergence, because I don't think that that's true, but I don't think it's always, perhaps because of funding, perhaps because of restrictions, it's not always taken into account as it might best be.
Yeah. Interesting. I think you and I need a disclaimer at the start of every episode to say we're not criticising the NHS. We're just saying that it tends to be, there are approaches, there are experiences that come to our conversations with people that come and see us.
Yeah, and I think, of course, you know, many NHS services aren't commissioned to work with people who have ARFID, and we see a really high kind of population of people because of sensory differences that may actually be struggling with ARFID as well, as neurodivergence. And often in a lot of areas of the UK, there aren't many services that will work with people who have ARFID. So that's a very real kind of problem that we've got.
what are the unique challenges of dealing with somebody who does have neurodivergence and also is presenting eating disorder issues for
Well,
you, as but also for the person who has to manage that journey, and the carer, the parent carer too?
yeah, I think there are many challenges, and I think they will, just as we are all individual, the individual will have different challenges. But we're thinking of the crossover, we're thinking of sensory processing issues. So some people might struggle with the feeling of food in their stomach. So it's not so much that they might fear weight gain, but they struggle with that feeling. People might struggle with different types of food. They may struggle with changes in, typically in eating disorder treatment, we think about having a variety of food, which is ideal. We're covering all bases, and we want a wide variety of nutrition for nourishment. But actually, there will be some people that will perhaps struggle with different colors of food, different textures of food. And we've got to take that into account. There may be some people that just want to eat the same thing every day. And I think typically in eating disorder treatment, kind of, we will look at, well, it's good to have variety, and you're sticking with safe foods, but they may not be safe because people are afraid of eating them. They may be safe because they feel more comfortable to eat texture wise, gut wise,
Yeah.
maybe a lot of things. So rather than just, well, we do it this way because you need to have this, we've got to really listen and listen out for things like sensory differences.
And actually, that discouragement can be the worst thing. I do a lot of work with schools around how do we make our kind of, the canteen environments better for young people with eating disorders who might be on the cusp of or trying to recover from eating disorders.
Mm.
And the number of teachers or even the canteen staff, sometimes I'll go around and see the canteen staff and I'll say, they're like, tell me about some of their challenges. And I remember one guy at one particular independent school, he was lovely, and he was often changing the menu, and he was saying, I make all their food really palatable, and I do amazing stuff for them, and I don't know what's the matter with them. And then they tell me that they can't now eat that because I've let their baked bean touch their sausage rolls or whatever it is. And that child almost ends up getting chastised or tormented by an adult that actually, no, you need to eat this as well as this because it's nutritionally good for you. Well, frankly, if you have that conversation with someone who's also neurodivergent and struggling with an eating disorder, you're sure as hell not going to get them to eat a bite by the time they sit down at the table. And likewise, it's why I bang on to some schools about what's your alternative provision. If that person has just come out of a recovery specialist unit, or to be in a journey with an eating disorder, the parent has disclosed it or the child has disclosed it, what's your alternative provision around a room that's not so flippin' noisy, isn't screeching chairs, lots of terrible acoustics? For me, those two things they're part of the eating disorder mindset, that all the noise, all the kind of environment, but they're also really on the neurodivergent spectrum as well.
Absolutely. I think that sensory overload, we really need to take that into account. And I think that rather than assume, oh, this is the eating disorder and we need to challenge that, I think when we're working with neurodivergence, we need to work with it. It's not about challenging it. Yes, there is an element of challenging. If for example, somebody has ARFID and the amount of foods that they will eat is very narrow, then it is about gently challenging, but it's gently challenging it within the ability and the kind of confidence levels of the person we're working with, because we will do more harm than good if we force somebody to eat something that feels terrifying for them sensory wise. Or so we've really got to think about, rather than just challenge, it's working with.
Yeah, absolutely. Rather than see it a barrier, it's
Yeah.
kind of recognizing the individual. And isn't that true for everything we've ever said about people with eating disorders and how we support the recovery? It's not saying, you're the white teenage female who needs this recovery pathway. It's about saying, actually, you happen to be 8 months pregnant, or you happen to be 48 and postmenopause or whatever.
Absolutely. And I think as well, we can really get caught up in that dynamic of control for eating disorders. I think it's, oh, we're not having the eating disorder be in control. And I don't think it has to be a battle, because I don't think it's very helpful either to try and remove control, because that's terrifying. And I think that, so it's working with, and once we work with somebody and we're on their side, there isn't a tug of war anymore. We're working together and we're much more likely to get the results that that person wants, because they're not pulling against us and we're not pulling against them. We're working together in the same direction.
You talk about the results and that resistance. Is it much harder for you as a therapist when you know that someone has a diagnosis or not? I suppose it doesn't so much matter whether they have a label, but they're presenting with
Yeah.
clear neurodivergence issues.
I think it's just different. I think
Different.
it's different. And of course, there are some really kind of rigid thought patterns. We see that in anybody with anorexia. And
Oh, I mean, I can say to you, God, diagnosis or not, but I could go back and say how terribly black and white my thinking was.
yeah,
Set time, set cutlery, set position at a table, not music, door open, door closed, this kind of food, this sort of temperature, radio on, radio off.
yeah.
It's very fixed in thinking.
It really is. And so anybody with an eating disorder is likely to have an element of rigid thinking, whether they are neurodivergent or not. And so we work with that. And I think it is loosening it. It can be more tricky to loosen that thinking, but also for somebody who's neurodivergent, they're likely to have had some interpersonal trauma growing up, some difficulties at school, and potentially very low self-esteem, carrying the results of trauma. And so we've got to think about those things as well. And rather than change thinking per se, we've got to understand the thinking and what purpose that serves and work with that. Because if thinking serves a purpose, we're not going to change that very easily. And for many neurodivergent people, they've had a difficult time, whether they were diagnosed or not, going through school, going through, oh, that's the wrong communication style. You can't speak like that. You can't do that. And so a lot of the thinking patterns are learned in order to be protective. So it's working with them rather than saying that's got to change.
It goes back to something you and I have talked about before, doesn't it? Around so many scenarios where people encounter an eating disorder in life, it comes to serve a purpose. For the short, medium, or long term, it brings us something. I think you talked about your experience of what it gave you in terms of your relationship with your dad, and at what time it served you and when it no longer did. And I can say likewise, where it took me from being the quiet invisible child to suddenly noticed and cared about.
Yeah.
And it feels almost uncomfortable admitting that, but there are certain points where I can see where having an eating disorder felt incorrectly, I would say, as if it was serving me kindly.
Yes.
And then, in a
Absolutely.
way, that makes it ever harder to say to that person, now I'm going to prise your fingers
Yeah.
away from this awful thing that's actually doing you harm.
And if we think about it, if somebody's neurodivergent and they have struggled interpersonally, here we are all of a sudden with an eating disorder that looks like people care about me. People are looking after me. People are moving closer to me. So, people are not attacking me anymore as they would have before, perhaps. So we start seeing why people will struggle to let go of it. That eating disorder serves a purpose. And I think rather than looking at the symptoms, we've got to look at the person and their whole experience and why this is happening and what purpose it serves and how we can help meet those needs and still be able to give them a good experience of life.
So, in your view, the outcome needs to be no less effective, no less likely that that person can achieve full recovery.
Yeah, no, not at all. But I also think we've got to listen to what the person wants. You know, somebody with sensory issues may well struggle with the idea of what I see as recovery. So I've got to work with what that person sees as recovery for them, what's
Mm.
enough for them. And always it's looking at a life that matters to them, finding
Yeah,
something that has meaning and life and a quality of life that for them is important. It's not about what I see as recovery. It's about, what do you want from this? What matters to you?
yeah, I love that sentence, and I use that quite a lot. That kind of I, it's not what's the matter with you, it's what matters to you. And I
Yeah,
think, and I say that, I said it on a call to a parent yesterday, actually, about trying to meet her daughter at a place where they can talk about the fact that her daughter wants to go on to complete her A levels, the fact that she still wants to be able to go out and meet her friends and have a summer job this summer. Those things are the things for which it's all the more important that she stays healthy and well and has support in doing so,
so
not singing hard on the thing that she's currently doing to herself, which is really self-destructive.
yeah. And I think, we talk a lot about restricting exercise, but I think that if we think about somebody with an eating disorder that's perhaps ADHD, it's thinking about bringing movement into that, because to ask somebody to sit still and do nothing, it's really difficult, and it's not helpful to them. So we've got to look at what's helpful for the eating disorder, but what's also helpful for the neurodivergence, and thinking about movement rather than exercise, and allowing somebody to be able to move, to be able to use their body, to perhaps to use some somatic work to think about kind of managing their emotions and yeah, because I think that we've got to bring the body into this. But for somebody who has sensory issues, that might be more difficult. For somebody who's ADHD, that might be more important. So again, it's just looking at that individual and what their needs are.
Yeah. So tell me, how important is it or not that there is a diagnosis involved? If you are thinking about you want to seek out eating support, eating disorder recovery support, for example, and come to someone like the Good Self,
Mm.
and yet you also think you have neurodivergence issues, do I need to walk into your therapy room carrying a diagnosis? Do I need to disclose it? What would you say? What's important?
I think and when somebody first meets me, they would have absolutely no reason to trust me initially. So they're probably not going to tell me. I may well pick up on some elements of it. And at some point when it feels that the relationship's sturdy enough and safe enough, we may talk about it. Or it might be that that other person might bring it into the room. But it matters not to me whether somebody has or hasn't got a diagnosis, whether somebody wants or doesn't want a diagnosis, because what we're working with is that human being that brings what they bring, and we work with what they bring. I may kind of have an idea in my mind of neurodivergence and keep that in my mind to work with, and I may never suggest it if I think a person probably isn't ready to hear that, but I'll work in a way that takes into account what they bring. So I think the diagnosis is not important to me unless it's important to the person I'm working with.
It's so important, putting them front and center of their own journey.
Yeah, some people really want a diagnosis and it's validating, it's helpful. In some areas, at school, often schools will make some changes according to a diagnosis, not so much without. It might be changing a bit in some areas. So in some areas, it's helpful to have a diagnosis, but but I don't think it's always what everybody wants, and I really respect that. And if it isn't, then we work with who they are, what they bring, and we don't need a title for it because they're a human being, and we work with the wholeness of that human being.
It's so important, isn't it? Look at the individual. So, what about for parents or carers who know that their child has very recently had a diagnosis, or they've reached an acceptance of the family that this person has neurodivergence issues? Are we saying on this episode, oh, by the way, you should be primed to consider that perhaps they also have an eating disorder, or not at all?
No, I don't think it's the case that everybody will. I think that it is the case that there, there may or may not be some disordered eating, but also what we know is disordered eating disorders are a coping mechanism. Not everybody will fall into using food and weight as a coping mechanism. There may be other issues, alcohol or drugs, or, so I think that we neither assume that everybody with an eating disorder is neurodivergent, nor that everybody who's neurodivergent will have an eating disorder. But it's being aware of the strong link between the two and just looking out for that, and listening. Yeah.
And I suppose the other thing I would want to ask, both from a parent's perspective, but both from also the individuals, and again, I bring my little disclaimer about NHS and absolutely not kind of bad mouthing in any way. But how do we help the individual or the carer advocate better if they know that they have sort of almost co-competing issues? How do we make a medical professional say, no, I really know beyond my issues with neurodivergence, I really realise I need to see someone for an eating disorder. Please don't dismiss this as being part of my neurodiversity. I mean, is that a likely factor?
I think it's really important if the person feels that they need some extra support for food, weight, and shape issues, that's heard. We can't guarantee that there are commissioned services for it, but I think it is important that that's heard and not just swept under the carpet, because I think that we know that if the person is worrying, that there's a good chance that there's reason for that worry. If they're worrying about their food, their weight, their shape, there's a good chance that there's good cause for them to be worried. And we've got to honour and validate that and work with what is. I think that similarly, if somebody has an idea or a belief that they're neurodivergent, it's about honouring that and listening to that and thinking about, okay, and what do you want to do with that understanding? What do we do with that? And I think it is really important to advocate for somebody that it's very easy with eating disorders to just see somebody that's scared or stubborn, and they will be, but we've got to be curious about why. We've got to be curious about what are the barriers here? What are the blocks here? What are the difficulties? Because I don't think anybody chooses not to change because they just don't want to change. It's because, there are multiple reasons for that. And we've got to be curious and understanding that there's more than what we can see. We've got to work with the person rather than a diagnosis or an illness. We've got to work with the entirety of that human being.
Yeah. Otherwise, our chance of commonality and dialogue is just ever diminished, isn't it? And we can't have recovery and a successful treatment pathway without commonality and conversation.
And I think we know that eating disorders and neurodivergence are often fully intertwined with shame. And if we don't create an environment where that person can be fully themselves, be able to unmask and say, this is how it is, this is how it looks for me, this is how it feels for me, then we can never work with that shame. And the way to work with shame, I would always say, is the compassionate approach, that acceptance of what is, and what do you want to do with that? But unless we can bring that acceptance of that person and say, this is a safe place to be fully you, we're not going to work with shame, and shame then gets deeper. And the need for the eating disorder to cover up things is likely to get deeper. So working with the shame that comes with both conditions is really important.
It's a really loaded and strong word, isn't it? And I think it's only really once you really delve into yourself, and perhaps more when you're an adult, that you can sit with where have I experienced shame? Where does shame sit in my journey? Why have I used these tools to deal with that shame? What do I do with that shame in the future?
Yeah.
I think maybe we'll delve into that a little bit more in another episode, because I certainly think a lot of people I speak to, particularly those that maybe have held on and had severe and enduring eating disorders, shame has been really deeply rooted in that. And it often recurrence of eating disorders. I saw someone recently, and she's now a mother, and she's had quite a successful career, and she's nearly 50. And there was a resurrection of something because something had happened in her private life. And that reminded her of shame and things that had happened a long time ago. And what she resort to doing was binge eating disorder.
Yeah, I think shame is really central. And as I say, particularly for people perhaps who have different communication styles, and that sense of being different and wanting people to come back into what's neurotypical, and actually, why? Why
Yeah.
should we? But when that's been the message time after time after time, year after year, then it's really difficult. And I think that in the therapy room, what's really important is to say, your communication style's welcome. Let's work together to communicate. I communicate like this, you communicate like that. How do we make this work?
Yeah.
And it's all
And
okay.
actually, the theme that runs through, I think, recovery from and management of an eating disorder, and also management of neurodivergence, is acceptance of oneself and acceptance of this is how I communicate. This is how I let the world know who I am. And this is what I am trying to change about myself. Whereas if I was to stop trying to change, shrink, adjust myself,
Yeah,
therein lies my ability to be content with myself.
absolutely. That acceptance piece is so important, but it's a big leap from being told so often that we're wrong, or what
Yeah.
we're doing is wrong, or and I think that's the key to shame. We're wrong, rather than what we do is wrong. It's we're wrong, and it's opening that conversation for acceptance.
Mm. Well, I think we've touched on a couple of things that I'll certainly have to dig into some extra episodes with you for, Sarah, because even that acceptance piece, I was reading a stat this week about the number of people, and this is men and women, having tweakments now. And there was something, I think they'd compared it to more people having tweakments than go to a football match and do
Wow.
kind of social activities these days, and whether that's kind of men tweaking themselves or women having a kind of butt lifts or lip pumps, whatever it might be. And that I find that really sad, and for me, I know it's not necessarily that person in any way has kind of disordered eating thoughts or anything like that, but it's just this world of lack of acceptance, and not perhaps communicating to the world or being comfortable with communicating to the world the real you. And
Yeah,
I'm not decrying anyone, trust me, I may get a few more years down the line and say I'm going to have a few treatments here. So I'm not ever ruling things out, but it was a sad stat to hear that, that's where we are. And
yeah,
to me, that says something. It says something about lack of complete contentment with oneself, I think.
yeah. I think we're not taught that, are we? We're always taught to strive for something else. And I think just sitting in that place, this is me, this is who I am, is really powerful.
Mm. Oh, Sarah, it's been amazing. Thank you so much for the conversation. And I'm really happy that Wednesday's Child would look to do some more around that neurodiversity area. So what we're going to do going forward is offer a lot more by way of webinars, which we're going to ask for a small donation for if you want to participate in those, because they'll be kind of small, closed events. But if something like a discussion around neurodivergence and eating disorder recovery and where the two coalesce, and ask anything of Sarah or indeed myself, then please do get in touch, and then we'll know whether it's worth it to you or worth it to our community to put something like that on. But for now, you've been listening to another episode of the Wednesday's Child podcast. Thank you so much for listening. Please keep your questions coming in, stay in touch with us, follow us on social media, and we'll be back with another episode very, very soon.